And indeed, for me, it's been a real great pleasure to actually be working again with my colleagues from the health sector in this CPG. We've had a very long and very interesting experience starting the first REACH program in a cluster of schools. And I'm sure it's not a randomized selection, it's the schools around IMH. But that started a journey whereby we had to better understand, we from schools had to better understand the framework of health. And I think vice versa. But along the way, I think what is now happening, and I'm most heartened about it, is that schools, through REACH program, through working with KKH as well, we seems to have more common language and a better understanding. So it is now quite common for counselors and teachers to call up physicians, and physicians who have a good relationship with schools to actually call up and work through issues about children. And I think that can only be beneficial in terms of providing access to services for the kids that we jointly serve. So what I will do is, in terms of its relationship to the CPG, what I'll be touching on in the pages 21 to 24, but I will not go through each one, but rather what I will do is perhaps highlight those few school-based supports that are dominant, and perhaps parents may come to you to ask for advice, or perhaps urge you to please tell school to do this for me, right? And then we can, hopefully I can share some information so that you can use that information, firstly, to give more targeted recommendations, but also sometimes you may need to advise parents to manage their expectations. Okay, so very briefly, but I'll not elaborate because I think Daniel touched on this, the impact of ADHD on school achievement, going on into academic intervention, classroom behavior management, that's key. And I'll spend some time on access arrangement. That's the official term for extra time, exemptions. In other words, what some parents see as the golden egg to having an ADHD diagnosis, unfortunately, right? So I think, and perhaps end off with some key guiding principles. Okay, we know that having ADHD lowers overall underachievement. This study is from overseas studies, but just looking at the kids that we work with, there's a higher risk for academic underachievement among children with ADHD. There's also a strong overlap between ADHD and reading disorder, as well as difficulties in mathematics. Again, the data is from overseas studies, but we see a much similar trend in Singapore. The implications for school-based intervention, therefore, are the following. First, focusing on behavior and attention is clearly important, but if you were to address holistically the needs of a child with ADHD in school, it is not enough. Medication and behavior modifications are important, and what we see is that this makes the child with ADHD available for the specialized remediation, teaching and learning that he actually needs in order to overcome the skills deficit that he has. So in addition to having medication and behavior medication, certain teaching and learning strategies that need to be built in and taught to the child so that he can then compensate and accommodate for the specific learning deficits that he encounters. Hence, this reinforces the idea of the need to collaborate between the different parties addressing the child's need. Okay. These are just some of the key examples of school-based support for learning. Okay, I'm sharing this with you so that if schools start to use this in their lingo, you can confidently and, oh yeah, I know what that means. Yeah? Stella, that's Strategies for English Language Learning and Reading. That's a special program in all primary schools. Learning Support Program, better known as LSP, that's for English and for maths. Singapore schools, as with the Singaporeans, we love our acronyms, yeah? Sometimes if you go to school and say, what's Stella? They will think for a while. They forgot what it means, just like sometimes we forget what REACH means, but we know what it is. There's also school-based remediation for students with persistent literacy difficulties, such as those with SDR. This only started in the last few years, so it's targeted to be in all schools by the next few years. I can. That's improvement, confidence in numeracy for both primary and secondary levels, but more in the secondary. At the same time, there's also subject-based remediation or targeted group-based skills training by teachers or allied educators. In schools today, there are what's known as teachers trained in special needs, or TSNs. These are teachers who have undergone about 108 hours of certificate training in special needs, and ADHD is a component of that. That's about 20% of teachers in every school trained that way. The allied educator, there are two types. One is for teaching and learning. One is for three types, learning and behavior. And the other one is for counseling. So depending on the needs of the child, you'll have different people providing different aspects. The thing to remember that in the school context, access to provisions is based on students' individual educational needs and not necessarily on the disability category. And this is something that sometimes there might be a miscommunication between what parents expect. My child has just been diagnosed with ADHD, so he must be in the learning support program. Yeah? But from the school perspective, does the child's educational needs fit the kind of intervention that is provided by the LSP? If it's not, then that's not an appropriate educational intervention. Yeah? So I think I was very happy when Daniel made reference to this. So the framework that makes sense to schools is RTI, response to intervention, not response to illness. Just to give you an illustration, for example, literacy. So there is what we call Tier 1 intervention, which is basically accessible for any child that shows some struggles. Programs like the Stellar programs, subject-based remediation, that's what we call Tier 1. And depending on the extent to which the child responds to that, he or she may then be provided with Tier 2. Programs like the Learning Support Program or the ICANN program, that's a Tier 2 program. And again, depending on how the child responds to that intervention in terms of the rate of progress, the rate of acquisition of targeted skills. If the child shows persistent difficulty, then he may be flagged up for the third tier. Okay. So in a sense, what does it mean for you if say, a child is presented to you by the parents? For one, it might be that the child already received Tier 2, even without diagnosis. So the child may actually have been receiving literacy intervention in, say, Stella, LSP, for a good number of months, or maybe a year, even before a diagnosis is given. And if you're in link with the school, what you could also ask is for the school to give the monitoring record of the child. The LSP, for example, looks at the child's rate of progress in terms of oral language fluency. And if you remember the presentation by Daniel this morning, one of the indicators of ADHD is the lack of fluency. That is actually a useful data which you can use in terms of looking at how does this child's rate of fluency improves or not when given sustained intervention. So that could be one source of information. The other implication for you is that don't be surprised if you see 5 children with ADHD and they get completely very different. Yeah, because again, the schools will use information about the child's functioning to map according to the profile of needs of the child. But what you can certainly do to help the school is to alert the school. Look, this child has been diagnosed with ADHD. Please look at the range of school-based intervention for learning and mathematics and identify those which best meet the child's needs. I will in this particular CPG, we've included an annex that we hope you can use because, and it's drafted with the school in mind because we understand how busy principals are and how schools work. So we think that making it structured will hopefully be easier for, we're also very busy, but also is presented in a way that we think schools can make sense of your request a bit quicker. Okay, the next part is academic intervention. This is taken from the CPG. that the diagnosis of ADHD on its own does not imply that the child has comorbid learning. However, they are at risk of academic achievement. The next component of school-based intervention that is typically recommended is classroom behavior modification. And this is necessary for two main purposes: to reduce the overt behavioral symptoms, sorry, that's wrong word, not systems, overt behavioral symptoms in ADHD, and foster academic engagement. FBA, or functional behavior assessment, can be a useful approach. And in schools, counselors, allied educators are trained to actually collect data for FBA. But in terms of strategies for behavioral management of ADHD, essentially there's two approaches. One, whereby the aim is to manipulate the consequences. And the other, which aims to manipulate the antecedents. Example of the first one, in a sense it is a bit more reactive, so use of token reinforcement, verbal reprimands, timeout. These are focused at the consequences. Examples of strategies that aim to manipulate the antecedents, more proactive approach would be posting clear and explicit rules, adjust work loads, modify instructions. I will elaborate a little bit on each of these. So the antecedent-focused behavior support strategies includes creating classroom environment that is positive, encouraging, and supportive. Teaching rules and reminding students of the rules and expectations frequently. The use of visual cues or verbal cues is usually very useful. What students with ADHD typically require is specific and immediate feedback about the behavior that they're demonstrating that is the expected or target behavior. And one of the things that we realize is, if you go to a lower primary school, many of these strategies are part and parcel of the classroom environment. Lower primary teachers tend to be very clear, they make rules very clearly, materials are color-coded, they remind children before they teach a lesson, they tell you, okay, for the next 5 minutes, I want you to sit down, hands on your lap, face to the front, right? So they give explicit instructions on the desired behavior before they start teaching. And that's for all children. The problem is kids with ADHD, they need those external scaffoldings long after other children have internalized it. And that's something that we have to repeatedly remind the teachers. Because, because otherwise they think, oh, he's bright, he's smart, he's P4. Why does he need all this again, right? And for some teachers, they understand that. For some teachers, they need that repeated reminder. Okay. In terms of the consequence-oriented behavior support strategies, things like verbal reprimand, timeout, you don't have to teach our teachers. They are very good at that. In fact, I find myself having to sometimes moderate that. For the past half an hour that I'm observing this class, you're very good at the verbal reprimand. You're good at recognizing the negative behavior, but on notice you only praise him once. And that's when he does his, oh, good, correct answer, but not praising the behavior, right? So, but having said that, this work too. But by themselves, they do not teach the appropriate behavior. Hence, we often need to remind teachers to balance between behavioral strategies that focus on the antecedents, which I mentioned just now, as well as the consequence. Praise, reprimand, they reinforce the existing behavior, whatever behavior that the child has. So these behaviors need to be taught first, right? So if you want the child to pay attention, he must know what does paying attention mean. What is the behavior that I'm demonstrating to show paying attention? And then you reinforce that behavior. And children with ADHD, they need more frequent and immediate feedback that they're demonstrating the desired behavior. Token economy is something that schools have over the years gotten more comfortable to do. And some teachers are more comfortable with it than others. Some of it may be due to exposure, because I think since 2005, all teachers that undergo their pre-service training goes through a compulsory module on special needs. So they come to school having a bit of understanding. Our challenge has been the more, but don't get me wrong, some of our best teachers are the more senior teachers. And I love my mother tongue teachers. They are wonderful. But I think perhaps it's expectation of what is an appropriate classroom behavior for a child. For some teachers, they expect absolute stillness and have very little tolerance for even productive noise. So for those teachers, I find that I have to do a bit more discussion, consultation with the teacher to sort of help moderate the expectation. And sometimes the best way is to invite that particular teacher to observe the child in another class, whereby another teacher who have perhaps a little more bandwidth for movement in the class. Yeah? Okay. There's also increasing openness and use of self-management and self-monitoring tools inside the classroom to observe and record the child's own behavior. And I just share with you a few that has found its way into classroom, thanks to iPad. It used to be many years ago, phones are banned in school, but now they are allowed, but with specific instructions in terms of when you can use it. So that has been helpful, iPads and iPhone. So again, these are two for different age group. On the right, it's more for your older kids, but basically it's an app specially designed to help the child organize the specific targets. And if you look at the bottom, there's also a reinforcer built in. And the older kid seems to like this better than star charts on the wall. That's too kiddish, yeah? Or marbles in the jar, right? And in fact, I think even our younger kids don't like the idea of marbles in a jar anymore. This is, again, another software, but you can see it's done a bit more visual for perhaps a much younger child who may not have the literacy skills. But these are things that certainly if you discuss with the teacher and parent, this can be part of the child's repertoire of self-management, self-monitoring skills. It's not cartoons, but it's count-toons. Used more with the younger age children. And this is where it's helping the child to make explicit what is the target behavior and what is how many times, and if you do that, what would be the reward that you get. My apologies for that being blurred, but you can get the full detail in that website there, and I'm more than happy to share my slides, so it's not an issue. But the idea is that you have 3 photographs. The first one says, do my maths. So the student needs to complete at least 6 maths questions and not be off task for more than 5 times before he gets reinforced or given a choice activity. So do my maths. Can you see the number, 5 or 6? Circle. Second one, off task. So there's a clear expectation of what is the expected behavior and what's the expected level of off-task that he needs to manage before he gets the reward. So I think sometimes what we find is that teachers and some schools, they need concrete examples like that. Telling teachers do a token economy or do in reinforcers may be too abstract. They need to unpack it in something that they can see and implement in class in a more concrete way. Okay, moving on. This is what I mentioned earlier, the golden egg, that sometimes parents see as the golden egg to a diagnosis. They don't want medication, they don't want intervention, nothing else. They just want this, right? Especially when the child is approaching P5. Okay, essentially access arrangement is the term that is used by SEAB, that's Singapore Examination and Assessment Board. And this refers to pre-agreed reasonable adjustments that are made to examination tests and assessment in certain subjects. A point to note, and this is sometimes where parents don't understand, having a diagnosis of ADHD alone is insufficient for getting approval of access arrangement during national exams. So having a one-liner memo, she has ADHD, give him everything, will not be sufficient, right? In addition to the diagnosis, there needs to be clarity about what is the functional impairments in the child, and therefore what kind of accommodations would best fit the child. Okay. The purpose of access arrangement is to compensate for the limitation imposed by the student's ability while maintaining the integrity of the assessment. So one of the key considerations of SEAB, or our colleagues there, they are the one that approve all this application, is that to what extent does this accommodation give the child undue advantage over other children? That's one of the considerations, right? Exemption from mother tongue is also something that parents often request for. But again, this is case by case, and there must be evidence that the child's level of skills or language processing is quite impaired and cannot be simply accommodated by getting an extra time for the exams. Yeah? So it's really based on the child's specific needs, not just the disability label alone. One of the things that we have learned and see when this is not very carefully thought of, very often the child gets the extra time. Okay, that's a clear indication. Okay. However, the child has not been sufficiently trained to do it. And I remembered one of the case whereby the child at the last minute applied for extra time, was given the extra time. And what happens is, and once you're officially given an extra time, this is Singapore, once it's written down, it's rule, the invigilator will actually give the child extra time. They will not let the child leave the room until the extra time is given. Everybody has left, the child is there, he went into complete meltdown. Because, he doesn't know how to cope with the fact that everybody has left and he's the only one trying. So the last few hours was actually not just a waste of time, but quite traumatic for the child. So really this is something that we often stress with parents again and again, please think through. And what we recommend is actually, again, develop that relationship with the school. Try it for school-based exam. You can use that time to also train the child how you use that extra time, how you pace yourself out. And sometimes for kids with ADHD, the extra time can be used not just to do work, but also take breaks. Accommodations, you can't say, I want to apply special examination to SVAB, please give the child minimum 5 toilet breaks. It doesn't work like that, right? But if there's sufficient evidence to show that his processing skills is lower, you can teach the child that one way of using the extra time is to take breaks. But the child needs to be taught that. You can't assume that the child knows how to do it. Okay. The application is done by the school, and the application would include, would need to have a report. And this depends on whoever that does the diagnosis or assessment of need. All this information is available in the slides. I won't elaborate in detail. You can also find it in SEAB's website, which I will give later. But I just want to give you this diagram to illustrate to you the kinds of accommodations or access arrangements that children with ADHD seem to benefit from. And this is again on a case by case, depending on the severity of functioning. Some of it are very technical terms that only teachers understand. Shared OAS answers after listening comprehension. What does that mean? You know what listening comprehension is, right? I mean, I'm sure you vaguely remember how you go through that. So there's as the child listens, there's actually a text. For other children, they will have to listen and circle the OAS. Optical, what's it called? Something or other, yeah? But you know this thing that you have to shade? Yeah. For children with ADHD, they find that difficult to switch. So the accommodation is to say, let the child listen and take, and don't bother about the OAS. Until the time is over, then he can transfer. So that takes the switching attention away from the child, and that seems to help. Inform oral examiners of the child condition, so that when the child comes in fidgety and looking at he knows and doesn't take that personally and penalize the child. For some cases where the child really needs to move about, you can make a recommendation for a separate room. But again, think through this very carefully, because some children don't like it, and they find that really stigmatizing. Prompter and visual cues. This is again for a child who really shows high level of distractibility. Prompting and can only be non-verbal. So no verbal prompting. Okay, so again, the child needs to get used to that using the visual cue and the physical prompting. Extra time is the most sought after, but again, the requirement is that there must be evidence that the child processing skill is sufficiently impaired, or his reading is significantly lower, or his writing, or his comprehension, right? Not just the fact that he has been diagnosed with ADHD. And of course, in some cases, exemption from some component. Okay. The application can be made 1 year before the exams. But we had schools that begged us for, we know that some schools actually submit the application the day before. The record is the exam is in the afternoon and the morning is the application. That runs the risk of actually being rejected and therefore unnecessary trauma. So again, if you're working with such patients, do advise the parents to seek the application early. If they have it, they can still withdraw. Because some parents say, I don't know whether I really want to go through it, or maybe he doesn't need it. That's why I think they should try to negotiate with the school to try the strategies, perhaps before the P6 exam. Yeah? And like I said, all the information and more are in this website. Okay. Similarly, for mother tongue exemption, mother tongue exemption and access arrangement, it is actually the school that makes the application, not the parent. But in doing so, the school needs to provide reports from relevant professionals, the teacher's observation, curriculum-based assessments. And in most cases, all three information concur, and they give a holistic picture of the child. In some cases, they contradict. I mean, there's many stories I can tell you, but whereby a request is made for extra time on special needs, but the report makes a conclusive statement that the child does not have any learning disability or reading disorder. And so that can be problematic. So again, the collaboration and communication is quite important. Okay, hence this last slide. Okay. And I just want to point to you to page 49 and 50 of the annex. In terms of, this is something that you can consider when you want to perhaps send a survey or a questionnaire or an observation checklist to schools, or even request specific information. That example, it's an example, you are most free to use your own, but there's a method to this because we know schools understand when things are structured like this. Yes, it is put in a language that we know schools can understand. Yeah, and direct it to the principal. And in fact, on our side, what we'll also be doing will be sharing this information and this page with school leaders and teachers, so that they see this, and the next time they see you send them this, they know what it's all about, right? So hopefully things will work out. But you know how communication is sometimes don't always go the way we are. Okay, with that, I thank you.